Well, Waldenström's has a number of unmet needs. There are patients who actually show high-risk disease, and how to manage these patients safely is an important, point. And so at this meeting, we have actually one of our consensus panels is focusing on helping to better define high-risk disease and the management. We also, I think, had to pay particular attention of how we're going to be using all these novel agents and sequencing them. When it's appropriate to have, chemoimmunotherapy, and when it's appropriate to have drugs like BTK inhibitors and BCL2 inhibitors, and recognizing the particular patient population. What I got most excited about was the youth at this meeting. We had a lot of young people who presented. So many of them. In fact, we had 32 young investigator award winners who came to present their work. And their genomic findings really inspired me, because I think they also are very much helping us understand another unmet need, which is how do we custom tailor therapies to individual patients. And a lot of their genomic findings speak to this. So I'm very excited by their contribution at this meeting. In the next meeting, we're going to have a lot more data on how to individualize therapy for Waldenström patients. And it's a big, opportunity, because we did learn that there are at least two major subsets of Waldenströms. They behave differently, but they also respond to therapies differently. And that's why I'm excited about the next workshop, because we're going to see where all this data goes.